I'm optimistic that if Marylanders continue staying home and continue practicing physical distancing a little while longer, that our numbers could continue to plateau. And I'm hopeful that we could then be able to begin our recovery in early May.
Well, just moments ago, we heard from Governor Larry Hogan with his roadmap to recovery in Maryland. There are now more than 16,000 COVID-19 cases in our state. 723 people have died. Hello, everyone. I'm Nicole Baker. The governor's plan does include 3 stages, and recovery will begin slowly, could begin slowly in May. We begin with live team coverage right now. Let's start with WJZ investigator Mike Hogan with details on what we have just learned from the governor. Mike?
Nicole, this is the first time we've heard any semblance of a date on when things might start to begin getting back to normal, but the numbers of coronavirus cases in the state are still rising.
Over the past several weeks, we have been consulting with leading experts and public health scientists.
Governor Hogan detailed his roadmap to recovery for Maryland, but he says the state is not yet ready to reopen.
The key numbers that we are most focused on are the rate of hospitalizations and the numbers of patients being admitted to ICU.
Governor Hogan says reopening must include increased testing. Baltimore County will open 2 new testing centers. They include a walk-in clinic at the Liberty Family Resource Center and a state emissions inspection center in Owings Mills.
Unfortunately, we're nowhere near where we need to be. We have increased our ability here in the county and across the state at testing, but we're going to need to see a much larger scale before we have a real sense of the number of people who are COVID positive.
Maryland reports 16,616 cases, 879 new infections in the past 24 hours, 723 deaths, that's 43 more, and the number of people hospitalized has gone up by 141. The governor says the state must see 14 days of decreasing numbers to start a gradual reopening process.
When we start to see that downward trajectory, or a consistent plateauing of those metrics, that can put us in a position to consider lifting the stay-at-home order and beginning our gradual, safe, and effective recovery plan.
And the governor outlined 3 stages. Stage 1 would allow some low-risk businesses to reopen and more outdoor recreation. Phase 2 would allow some restaurants to reopen, but with safety guidelines and social distancing. Phase 3 would allow restaurants and bars to reopen pretty much as normal, and families could start visiting people in nursing homes again. But the governor says things won't go entirely back to normal until we get a vaccine. Reporting live in Baltimore, Mike Helgren, WJZ.